Hi dudes, welcome to my letter discussion. Today I'm going to explain you regarding one letter. The patient name is Mr. Jonathon Singh. Let me explain you with the case note how we will present a letter task. So many students have the problem how to organize a letter and how to start, how to end, and mainly they will have the problem with the body paragraph. So in such a case note, you can see that this is a pretty large letter and you will have difficulty to concise the points while writing the body paragraph. Even the introduction paragraph, it is little bit easier, but when you are going to the body paragraph, there will be much confusion. So here I will present you the way how you have to concise the content into a particular range of body paragraph. So let us see the case note. So I will give you some tips while explaining the letter. The first tip, whenever you will get the case note, you should not read from the start to end. Just go to the writing task and have a quick look. So from that area you will get an idea regarding what is your role, to whom you are writing, what is the type of letter, whether it is known case or unknown case, and what is the requirement. So most of the time you will get these all relevant data from the writing task, because if you start from the beginning, you will read everything, so your mind will be fixed with every points. So if in case of noun case letter, including the social history, it will be fixed in your mind. So it will be difficult for you to remove such points while you are writing the letter. So it is easy. You will start with the writing task. So in this letter, you can see that the writing task is write the letter of referral to the Director, General Repatriation Hospital, Dog Park, using the information above. So it is a simple writing task. They have given, we can see that this is a referral letter to the director. We are going to write director. So whenever you are writing the letter, keep it in your mind to whom you are writing. So that is important point, because here you don't know that this director is medical person or non-medical person. So you have to write within a simple sentences, not like a medical. And you can see the address here and nothing else. They didn't give anything. Then we will start from the beginning. So the case note start, the hospital name is Flinders Medical Center where you are working. Patient name is Mr. Jonathon Singh, age 63 years. And whenever you will read it, please try to mark or underline the relevant data. So in the letter task, you will have three types of sentences. I mean the data: relevant data, irrelevant data, and semi-relevant. All relevant data have to be included in your letter, and irrelevant data you have to exclude. Semi-relevant data, it's your option. You can write or you can exclude. So whenever you will read, just mark it that all should be the relevant data. So here you have to underline name, age, and it's given the address of the patient. No need actually. Marital status needed, married. And next of kin is Mrs. Megan Singh, and phone number is given. That one also no need. And admission date and discharge date, diagnosis, and past medical history, it's needed. Admission date 22/10/2008. Discharge date is 26/10/2008. Diagnosis, it's much important: carbon monoxide poisoning with a home kerosene heater. Past medical history, these data we need it for social history paragraph. If it is known case, this paragraph actually no need, but this is unknown case, so you have to write. So underline cataract surgery 12/5/1999, surgical repair of prostate hypertrophy 29/9/2005, psoriasis, constipation, impaired vision, and using glasses. And we can see retired bank employee, that one we need, lives with a wife and adopted daughter, but both overseas at present. So these all relevant data for our social paragraph. Then we can see the presentation of the patient in the hospital. The day 1, 22/10/2008. On examination, widely dilated pupils, unconscious, cold clammy skin, cherry red lips, and skin dyspnea. Physical examination assessed for head injury or other precipitating factors causing coma. Negative result. Blood test for blood sugar to diabetic, negative result. So keep it in your mind. You are going to write letter to the director. So cannot be a medical person, may not be the medical person. So just underline anyway. Violate idle people, unconscious, cold and clammy skin, dyspnea. So when you are writing letter, we can write it is like a symbol. Then the treatment given. So here in this letter you can see they have given from admission until discharge, but all the data it is more or less same. The treatment what has given nursing managements are more or less same. So no need to take all data. What are the important thing for our reader to understand? Only those things we have to go in, we have to write it in our letter. Anyway, we can see what the treatment they have given. Oxygen sats at 98 percentage on 2 liter per minute through the nasal specs. Hyperbaric oxygenation, hourly assessment of vital signs, calm environment. NG2, we need to underline NG2, inserted for feeding, monitored for asphyxia, register visit 2 p.m. And the remaining things are 11 data. Knees flexed using pillows, we need it. Underline. Footboard to prevent foot drops. Underline. Pressure care area, frequent change in position and back rub. Indwelling catheter, skin care for psoriasis. These three should be underlined because these are the management. The important management is what they have given and we can write it in a simple manner. On observation, patient comatose, but no other physical injuries, no asphyxia. So patient comatose, that one needed. Then the next day, you can see this is the repetition, the same. Oxygen status, hyperbaric oxygenation, hourly assessment, calm environment, NG tube, skin specialist assessment, psoriasis, skin care for psoriasis, food board to prevent food drop, pressure area care, skin intact, IDC training, moderate amount. So these all are common for the nursing management. So no need to underline anything because this is the repetition from the previous day. And the next day you can see the same. So here in the observation you can see that patient have right hemiplegia. And day 3 you can see the same assessment for consciousness. GCS was 14 but varies. Hourly assessment of vital signs, calm environment, good ventilation, NG tube removed, liquid diet per oral, mobility assessment, right-sided weakness, speech affected, vision as per normal for this patient, small pillow placed on affected right side for prevention of adduction of arm, physiotherapist assessment and commencement of passive exercises. Then pressure care area, removal of IDC. So these all are the same repetition, more or less same. Then we can see the observation level of consciousness with right-sided weakness. So patient have now right-sided weakness, but comfortable, depressed and anxious, reprognosis. And the next day we can see assessment for consciousness, which is 15, 2-hourly assessment of vital signs, physiotherapist visit, passive exercise continued, range of motion gradually increased, then pressure care area care, full ward diet and fluids. Observation, patient mentally stable. So these all observations are needed. You have to underline patient mentally because this is the current upon before discharge. This is the I mean the letter date. So this is the last part what we have to include in our present medical history. Patient mentally stable but depressed, making steady physical progress. Doctor has advised discharge tomorrow and further rehabilitation at the General Repatriation Hospital. So these all things are important. And one more thing, the patient is going to discharge tomorrow. So our letter date will be different. The previous day how to keep, or else the day previous date we can keep and we can write that tomorrow the patient will get discharged. Nursing management provided comfortable stable environment, output, skin integrity, diet monitored, assistance in regaining physical health. Discharge plan is important because these are the recommendation. These are all the content for our recommendation paragraph. Daily assessment and support from physiotherapist and possibly occupational therapist for increased mobility and physical ability. Psychiatrist visits to be initiated regarding depression caused by loss of mobility and independence following the accident. So here we have three recommendations: one for physiotherapist, one for occupational therapist, and another one is for psychiatrist. So these are the recommendation paragraph data. And again, we will return back to the writing task. Once again, we will read that: write letter of referral to the Director General Repatriation Hospital, Doe Park, using the information given above. So, from this letter task, we can come to the conclusion that this patient currently has right-sided weakness and depression. So, this is the requirement for the patient. So, the patient have physical disability with the right-sided weakness and depression also because of the accident. And this is the reason to present medical condition. This is the present situation for the patient, and the requirement is for this we need continued care or follow-up care or an ongoing care. So whatever the thing we can write in the introduction paragraph. So now let us go to the letter, how we can present it to the OET letter format. So let us start with the date and address: 25 October 2008. The director, because the name is not given, only the designation, so we have to write the director. General Repatriation Hospital, Doe Park. So here the tip what you have to keep it in your mind: if the name given for the reader, you can write example, if the director name is John Paul, we can write Mr. John Paul down, just director. So if there is no name, you can write the director. Salutation, dear sir or madam, regarding Mr. Jonathon Singh, aged 63. And if the reader is any one designee of nurse, example registered nurse, community health nurse, psychiatrist nurse, chief nurse, nursing director, whatever. If it is like that, you can write dear nurse if there is no name. But this is the director, he is in a managing position, so you have to write dear sir or madam. There should be caps lock and M should be capital letter. We will move to the purpose paragraph or introduction paragraph. In this paragraph, you have to write three things. One is we are introducing with the patient name, and the second one you are writing the patient current present medical condition. It will not be always diagnosis. The time of the discharge, at the time of writing the letter, what is the condition of the patient? So now, what is the current situation of the patient? Then the third one, you have to mention the requirement, what you are expecting from the reader. And the discharge status, it is optional. You can write or you can exclude, it's not a matter. So here we can write like this: I am writing to refer Mr. Jonathon Singh, who has physical disability with right side weakness and depression. So this is our recent present medical condition. He requires continued care from your facility. This is our requirement, and is said to be discharged tomorrow. This is our patient's discharge status. So most of you will get confusion what to write in the recent present medical condition, isn't it? Maybe sometime you will think that who is recovering from poisoning or who has something else. So here nothing is there to be worried much about the recent present condition. Just you can see at the time of letter writing what is bothering the, what is the most presenting condition, not presenting condition, what is exactly the patient is suffering now, and which should be related to the reader. Example, if you are writing for a social worker, you could not write every time the diagnosis. You have to mention something related to the social worker. It's according to the writing task. Always it will not be same, but according to the writing task, we can change the recent present condition. But there should be something correlation is there. The first, I mean the recent present medical condition, what you are mentioning, this one should be explained in detail in your next paragraph. And what you are writing here, the requirement, it should be explained detailedly in the recommendation paragraph, the last paragraph. So there are some correlation inside the letter, so it should not be wrong. If you are writing your introduction paragraph wrongly, your complete letter will be wrong. So take care while you are writing your introduction paragraph. In the answer sheet itself, the last page, you have one extra additional extra page is available. So if you got a confusion how to write the introduction paragraph, you can just write it in that paper. You can just see whether it is correct or no. Then you can copy to your original answer sheet. So that page you can utilize while you are appearing for the exact examination. I mean for your exam. Next, we will move to the present medical paragraph. This is the crucial paragraph. You will get more confusion. Actually, this body paragraph is somewhat big, but you can see how to concise it. So here we will start from the beginning. Actually, you have to keep it in your mind. This paragraph should be like a story, because you will get more data and you will get confusion what is relevant, what is irrelevant, what is semi-relevant. So you will have more confusion, how to concise, how to make complex sentences into simple paragraphs, simple sentences. So here if you can utilize your logic how to organize your letter. Nothing, it is easy, simple way. I can tell you that you can take the case note like a story, because it's given like a story. Right, in your case note it's given like a story from the patient admission until now. When you are writing the letter, it's like a incidents like happen, but sometimes there will be repetition. Same like in this letter, you can see many things are repeated, the nursing management. So the first thing what I told you, that you have to underline. So now you know that what all the things are relevant data. Now we are going to make a story, but it should be like a OET format. Maximum try to write it in a passive voice, and rather than the active voice. Some of them are not aware of passive voice means nothing. It is easy. Just we will write like in opposite way. While case note explanation, I will tell you. So just think to make it like a story. Start with the date when the patient admitted in the hospital, and what all the presentation was there at that time, and what are the management we have given, and presently what is the improvement, and at the time now when you are writing letter, what is patient's current situation and why we are writing the letter to the reader. This much content should be there in your body paragraph. Only this paragraph can be splitted to two, not other any paragraphs. Only body paragraph, I mean the present medical paragraph only you can split if it is large. So we will start with the patient. So here from here onwards you have to write patient's surname. If the patient is less than 18 years, you can write the first name. So Mr. Singh was admitted on 22 October 2008 following carbon monoxide poisoning from a home kerosene heater. So here we can just write how the patient came with what. Then we can write on arrival, comma, he was comatose. So we are writing the letter to the director. So no need to write much about the problems what we find out during the arrival time. Simply we can sum up. Then next we are going to write what are the management you gave in your hospital. During hospitalization, comma, he was managed with the oxygen therapy, nasogastric tube feeding, as well as frequent positioning and back rub. So here we have more relevant data, but here you have to organize the thing according to the priority, or you can I can tell that it's like common things. You can make it like a single sentence, and then you can write in another one sentences with relevant data, but should be similar data. Here I can tell you that oxygen therapy, tube feeding, positioning and back rubs, these all it will come like a action. So we can keep it like a together. And what I mean by passive voice, you can see he was managed with oxygen therapy. So this is passive voice. If you want to write it in like a active voice means how you will write. We can if it is a passive voice means we have to write that oxygen therapy, nasogastric tube feeding, frequent positioning were given. So like that we can write, but it is good to tell like this way. He was managed with oxygen therapy, nasogastric tube feeding, as well as frequent positioning and backup. So many relevant data we sum up in one single sentence. Then we can write the next one. We can use additionally or in addition. Please don't use furthermore, moreover. These all are out of the syllabus of OET. So in addition, he was supported with a urinary indwelling catheter, pillows for his knees, and a footboard to prevent foot drops. So this is like together we can write, it is like related things. Indwelling catheter, pillows, footboard, these are like assistive devices and some devices, and upper one, the previous one, all are care like procedure. So that's the thing I told you, the similar things have to be connected together in one sentence, and the remaining thing can be another one sentence. So the letter will not look like a cloud. Then the last one, his psoriasis has been managed with skincare. So this is somewhat big sentence, I mean the paragraph, so we can split it into two. So the first thing should be according to the priority. We have written everything and it's like a story. We have started with oxygen therapy and NG feeding, then positioning done, and the back rubs done, then connected with the catheter and some pillows, assistive devices we have given, and for the psoriasis we have given some additional skincare. So this is like a step by step. We could not write like as our wish. It should be prioritized and should be in a neat way. And we can write the same present medical paragraph in another one paragraph because it is somewhat large. So in the next paragraph, we are going to write that gradually patient, these all the things we did like immediately within 2 days, and the remaining things we can tell gradually, comma, Mr. Singh was commenced on physiotherapy with the passive exercises. His range of motion and physical strength were slowly progressed. So here we are introducing the physiotherapy. So he was commenced on physiotherapy, and what all things we did, passive exercises. With that passive exercises, his range of motion and physical strength were slowly progressed. Also, this also we can use instead of moreover, and you can use in addition the same, but repetition should not be there. Also, comma, he started his normal diet pattern. Then this is the conclusion we are writing, that currently in this point when you are writing the letter, what is the condition of the patient, what is the situation. So currently, comma, he is mentally stable, even though, comma, he is depressed about his loss of mobility and independence following the accident. So this is like a summary. This is actually in most of the letters, if you are writing in this way, the presentation will be fairly good to see, because for the reader, it is very easy to understand what we are meaning, for what we are writing. And if you are giving just like a simple conclusion, it is everything clear for the reader, because we are writing that everything it is good. Currently he is mentally stable, but he is depressed. That instead of but you can use even though, or you can use but. Is depressed about his loss of mobility and independence following the accident. Thus, an expert service from your facility is highly essential. That means the patient slowly progressed but not completely progressed. So with that one we mentioned already, physically visibility. That is the thing I told you, that what we are writing, the recent present medical condition, that should be explained in our present medical paragraph. That there what we wrote patient has physical disability and depression. So these two should be explained in detail in this paragraph. So we explained regarding the physical mobility is impaired, and regarding the depression also we mentioned here. So thus an expert service from your facility is highly essential. So for the reader it is very clear that they have to give importance for to increase his physical activity and to give some support for his depression. So it is much clear in this conclusion. I hope this paragraph is clear for you. We will move to the social history paragraph. Mr. Singh is a retired bank employee who lives with his family, but, currently, his wife and daughter lives overseas because now they are not with the patient. Medically, he had cataract surgery and prostate repair in 1999 and 2005 respectively. In addition, he has impaired vision. So here, some of the students, I could say that they will mix up everything, personal history and medical history and surgical history. Actually, in this paragraph, we have to write everything. I mean the personal history, social history, medical, surgical, everything. But it should be like arrangement, within arrangement. You can start with personal history. It's easiest way. You can write personal things and habits related to the personal things, the drinking habit, smoking or anything else. something like that. Then you can start with the medical, what all the medication, what all the medical history. It started before and now is ongoing, and something has happened before, and presently if something is there, and what are the medications. It's relevant medications only need to be right, and regarding the surgical history. Then in addition you can write something if it is there. Additionally, if you want to add something, you can add it here. And here is you can see one rule. There is a usage of has had, and had. What is the difference between this usage? Means it is easy, just you can note it down in your diary because it is much important. In the medical history, if the patient, example, if the patient have hypertension, and in the case note it is written that hypertension started from 2010 or 2015, that means the patient has started diabetes from 2015 and now ongoing, and on patient is on medication. So the date and the time it's mentioned there means you have to write he has had diabetes since 2015 and is on regular medication. That means if the time period is mentioned, the date or month or year or whatever the thing is mentioned, you have to write has had. He has had this condition since this year or for the past this many years. Something you can write for the past 2 years, like that. Then you can make, if there is medication, you can write it in along with the disease condition. Example, now they are telling the patient has hypertension. That's all. They didn't mention that from when it started. In this case, you can write he has hypertension and is on medication. Simply has, because you don't know the year. And something in same, like in this case, you can see the cataract surgery and prostate repair. It's happened already finished. So you have to write had. He had cataract surgery. And another one more technique is there. If you have two things and two things are similar and you have relevant data for both things, you can write with respectively. It is good presentation. It is a good presentation. The way of presentation is good if you are using respectively. But you have to see, here you can see cataract surgery also done and prostate repair also done, and it's given the year 1999 and 2005. So you can write both. You can togetherly you can write he had cataract surgery and prostate repair in 1999 and 2005 respectively. That means cataract surgery done in 1999 and prostate repair done in 2005. In addition, we can write what all the things are there. Next, we will move to the recommendation paragraph. Recommendation paragraph, as I told you, only 3 recommendations are there. So we can write kindly, we can use kindly, please, it would be appreciated if you could, or it is essential for him or her to, it is important for him or her to, off not, then it is please not, kindly not. So these all connectives you can make use in this recommendation paragraph. So here we can write kindly, comma, actually there comma no need. Kindly arrange a physiotherapist for Mr. Singh for daily assessment and support, and an occupational therapist for increased mobility and physical ability. It would be appreciated if you could initiate the visits by the psychiatrist for his depression. So it is clear that they need, they have to arrange a physiotherapist, an occupational therapist, and a psychiatrist for his problems. So this is simple and humble recommendation paragraph. If you are writing the letter for a community health nurse, you may have many things you have to concise here. So in further letters, I will explain you how to concise the content in the recommendation paragraph. Next is the conclusion paragraph. This is common for all type of letters. If you have any queries, please do contact me. And here you have to think about whether you have to use faithfully or sincerely. If in the case not the reader's name, not yours name, reader name is given, means you have to write sincerely. If it is not given, you have to mention faithfully. In this letter, actually there is no name given. It's written only to the director. So you can write yours faithfully down, registered nurse. There is no comma, no full stop, nothing. So this is our letter. I hope the explanation was useful for you. Please try to write the letter in this way. So this is a simple way. Actually, I didn't use any complex sentences, and the basic things you have to understand and you have to keep it in mind when you are writing letter, the same what I told you, to whom you are writing, that should be in your mind always. And what is your recent present medical condition, what you wrote, it should be explained in the present medical paragraph. What you have written mentioned in the requirement, it should be explained in detail in the recommendation paragraph. And after each paragraph, you have to go for proofreading. Proofreading nothing but you have to read it again. When you are read it again, it should be with your complete attention. Please keep your attention while you are doing proofreading, because many of the mistakes you can find out during this process. While you are writing, it will be in your mind and it will come to your tongue silently, and you will write it in at the tip of the pen or pencil. But when you are doing, you will think that everything is written, but most of the time you may have article problem, and you may have spelling mistakes, and sometimes there is a repetition. Some minor mistakes can happen while you are writing. It is common. But when you're doing the proofreading, everything can be found out and you can clear it from then and there. Or else at the end you will read and you will find out some big mistakes, and you will not have the time, or even you will not get the space to write. And when you are writing, overwriting, sometimes there will be overwriting, sometimes you will raise and you will write, and the presentation of the letter will not be good, and you will become panic, and there will be much more problem in the exam. So it is better every time when you are writing your letter, after each paragraph, just you go for the proofread. It will not take much time, only few seconds. Just go through it, and if there is any mistakes then and there, you can just make the correction and go to the next paragraph. So in the next video we will see another one case note. Until then, bye, thanks for watching. Hi dudes, welcome to my letter discussion. Today I'm going to explain you regarding one letter. The patient name is Mr. Jonathon Singh. Uh, Let me explain you with the case note how we will present a letter task. So many students have the problem how to organize a letter and how to start, how to end, and mainly they will have the problem with the body paragraph. So in such a case note, you can see that this is a pretty large letter, and you will have difficulty to concise the points while writing the body paragraph. Even the introduction paragraph, it is little bit easier, but when you are going to the body paragraph, there will be much confusion. So here I will present you the way how you have to concise the content into a particular range of body paragraph. So let us see the case note. So I will give you some tips while explaining the letter. The first tip, whenever you will get the case note, you should not read from the start to end.